Welcome to our discussion on metagenomic next-generation sequencing in acquired immunodeficiency syndrome-related pulmonary infections. We'll explore the diagnostic value and clinical implications of comprehensive pathogen spectrum analysis, as presented by Wu Liang and colleagues in Open Forum Infectious Diseases. Pulmonary infections in acquired immunodeficiency syndrome patients are challenging to diagnose accurately. Despite antiretroviral therapy advances, these infections remain a leading cause of death. Conventional diagnostics are slow, often taking days to weeks, and lack sensitivity, especially in immunocompromised individuals. Additionally, traditional methods cannot comprehensively screen for all potential pathogens, highlighting the need for improved diagnostic approaches. This study at Beijing Ditan Hospital involves 64 AIDS patients with pulmonary infections. Within 48.72 hours of admission, bronchoscopy with bronchoalveolar lavage fluid collection was performed. Samples were analyzed using metagenomic next-generation sequencing, conventional microbiological testing, and droplet digital polymerase chain reaction. Statistical methods included kappa consistency, Pearson chi-square, Mantell tests, and random forest analysis to assess pathogen sensitivity, mixed infection patterns, and clinical pathogenicity scores. Our patient cohort was predominantly male, reflecting human immunodeficiency virus epidemiological trends. A significant portion was antiretroviral therapy naive or had discontinued treatment, heightening risk for severe opportunistic diseases. Most patients improved clinically, but factors like low partial pressure of oxygen and high neutrophil percentage indicated worse outcomes, emphasizing the need for early pathogen identification. In our study, 54.7% of patients were clinically diagnosed with Pneumocystis pneumonia, yet etiological confirmation was often lacking. Metagenomic next-generation sequencing and conventional microbiological testing identified pathogens in 75% of cases, but 25% remained undiagnosed, underscoring the diagnostic challenges in this severely immunocompromised group. Mixed infections were prevalent, with 55.2% of patients having co-infections. This poses a significant challenge, especially in immunocompromised AIDS patients. The most common pattern was PCP, with bacterial infection at 25.9%. Metagenomic next-generation sequencing is crucial for detecting multiple pathogens simultaneously, offering a comprehensive view of this complex landscape. Metagenomic next-generation sequencing identified 45 distinct pathogens from bronchoalveolar lavage fluid samples, surpassing conventional testing. It detected 28 bacterial, 14 viral, and 3 fungal species. Remarkably, metagenomic next-generation sequencing found pathogens in 76.5% of conventional microbiological testing negative samples, including Candida albicans, Stenotrophomonas multifida, Epstein-Barr virus, and respiratory syncytial virus, highlighting its superior detection capability. The sensitivity of metagenomic next-generation sequencing surpasses conventional microbiological testing across all pathogen categories. For viruses, metagenomic next-generation sequencing achieves 80% sensitivity compared to conventional microbiological testing's 20.83%. Bacterial detection is more than twice as effective with metagenomic next-generation sequencing. Although smaller, the gains in fungal detection are crucial due to high mortality risks. These results highlight the need for methodological humility. Concordance between metagenomic next-generation sequencing and conventional microbiological testing highlights critical nuances. For Mycobacterium tuberculosis, conventional microbiological testing shows higher detection rates, emphasizing the need for conventional methods. Pneumocystis jirovecii shows equal rates, with droplet digital polymerase chain reaction adding value. For cytomegalovirus, low concordance limits metagenomic next-generation sequencing utility. Severe acute respiratory syndrome coronavirus 2 detection favors metagenomic next-generation sequencing, but polymerase chain reaction remains the gold standard. Random forest analysis ranks pathogens by importance, highlighting Candida albicans and Stenotrophomonas multifida. While Candida albicans scores highest, its colonization risk in bronchoalveolar lavage fluid requires cautious interpretation. Stenotrophomonas multifida, ranked second, poses significant clinical concern due to its drug resistance, especially in immunocompromised patients. These findings are exploratory, necessitating further validation before clinical application. Mantle test analysis reveals a significant correlation between pathogen spectrum and clinical variables. Older patients exhibit distinct profiles due to immune senescence. Microbial complexity links to discharge outcomes, offering prognostic insights. Antiretroviral therapy-naive patients show broader pathogen spectra, highlighting antiretroviral therapy's protective role. Lower cluster of differentiation 4 counts correlate with diverse pathogens, emphasizing immune status in diagnostics. Metagenomic next-generation sequencing offers significant diagnostic advantages in acquired immunodeficiency syndrome-related pulmonary infections, especially for complex cases. However, it should complement, not replace, conventional methods. Its results require careful interpretation alongside clinical and immune data. Future research should enhance sample sizes and standardize methods to fully harness metagenomic next-generation sequencing's potential in human immunodeficiency virus/acquired immunodeficiency syndrome care.